As Marie said, I'm Sharon Faraci. I am the co-president of the Breast Cancer Network of Western New York. I'm here to encourage you to listen and learn about the benefits seriously ill patients will be able to receive when the Compassionate Care Act is passed in the Senate. I'd like to say thank you to Senators Kennedy, Maziarz, Grisanti, and Robach, who have declared their support. In a new Quinnipiac recent poll, 88% of New Yorkers say they support allowing the use of medical marijuana in the patients, for the patients that the doctors recommended. You might be surprised to know, I found some interesting facts. You might be surprised to know that it wasn't just the ancient people in China that were using cannabis and opium, but also marijuana remained in the United States a pharmacopoeia until 1941. Also, it was available in the UK. Queen Victoria, the most conservative of royals, used cannabis to alleviate menstrual cramps. So people have been using it for a lot of different things besides seriously ill incidents. I'd like to say that marijuana is a botanical. Under the Compassionate Care Act, it will be grown indoors in a controlled environment and supervision by the Department of Health. There won't be backyard pot farms that are going to be harvested. It's a natural plant. No one has ever died of an overdose of marijuana. It can be ingested, vaporized, or used in a lotion or oil or ointment. Under strict controls and tight regulation, a patient who has been certified by their healthcare provider, a provider that is licensed to prescribe controlled substances, would register with the New York State Department of Health. That patient would receive an identification card. To be certified, the patient would have to have a severely debilitating or life-threatening illness for which medical marijuana is likely to have a therapeutic palliative benefit. This certification would last for 1 year, and then it would have to be renewed. If a patient is under 18, then an appropriate adult or legal guardian would apply and register for that minor. There is a strong body of research that has been done about medical marijuana's benefits for treating symptoms. Some of the illnesses that we have had research done on would be epilepsy. It reduces seizures. Multiple sclerosis. It relieves spasticity and pain. Parkinson's disease, Crohn's disease, post-traumatic stress. Arthritis. It can reduce the inflammation for an arthritic site. Neuropathy. Neuropathy, in many cases, has been a side effect for people going through chemotherapy. They are left with neuropathy, which is a numbness and loss of feeling in both their hands and their feet. HIV/AIDS. It can reduce pain and it encourages appetite. Extreme nausea and vomiting renders patients unable to function. My experience with the breast cancer survivors, who I'm proud to say are now thriving, has been that their healthcare providers actually suggested getting illegal marijuana. They have, and it worked. I can't say anything else about that. Why would anyone not be in favor of showing compassion to patients? These patients are suffering. Why wouldn't you want to pass a bill that can show them compassion, give them relief, alleviate their suffering? Please consider the following facts. We would have strict control and direct oversight by the New York State Department of Health. Patients getting certification would get certification from their own physician. You wouldn't be able to just have someone go to another physician they find in the phone book and say, yeah, I really need this medical marijuana. It has to be their physician who is treating them for the illness. This is a natural plant. There won't be any synthetics. And again, no one has overdosed and died from medical marijuana. This is a medical, not recreational issue. Medical, relief, compassion. What you can do to help move this along is send a letter to your congressman or your senator supporting the act. Visit our website, which is the CompassionateCareNYNewYork.org. You can invite an advocate to your next meeting of healthcare providers or consumers, any other advocates that you know of. There will be a petition circulating. Please become an advocate for something that could benefit so very many children and adults. Thank you.